My name is Carolyn Sellinger. I have struggled with weight since I was about 20. I'm a mother of 3, and I'm mainly doing this for my health and getting off some medications if I can and things like that. So I just want to be happier like I used to be. So. I've done a lot of research, and it's been over 2 years since I started my journey into where I was going to go and what I was going to do. Oh, yes. I was actually in the program for 8 months, and they didn't put me through, and I was really ready for it. So that's when I decided to go this way and get my surgery in Mexico. I'm excited at this moment. Who's to say along this journey how that's going to go, but I'm excited to be going. A little scared of the unknown, but we'll get through it. To reach my main goal weight, but I think as you're losing weight, you need to set reasonable goals and then go down from there. So the other goal is I'm on a lot of medications, and I'd like to get off of those, which losing the weight will help, and to be able to walk without pain. The 4-week pre-op diet wasn't that bad for me. I had a few days where I missed food, but generally it went really well, very well. I think so, and anything that I didn't get information-wise that I felt I needed more of for just the pre-travel and getting there, I asked questions. — 12 pounds.
Oh, right on. That's great.
I've lost 12.
So when the patient arrives downstairs in the van, I will go downstairs and meet them. We'll come back up to LIMARP and we'll do their blood work and their ECG that day, pictures, consent form. I will take them over to the hotel, get them into their hotel, sign them in, take them up there, prepare them a little bit, make sure they're getting in their fluid intake that day. A lot of times, we'll go for broth with them if we have the time. I will call them that night, let them know what time to meet them the next morning in the lobby. When I'm talking to patients, they feel that having a Center of Excellence hospital and having the support are two huge important things for them to look for. I'm here to give them support, to let them know what to expect the night of surgery, going through all the symptoms they may or may not have. So the more prepared they are for the surgery and to actually understand what to expect, the better the experience will be for them. So how was your flight here?
Flight went really, really well.
Good.
Very smooth, and our driver was there at the bottom of the escalators as soon as we arrived.
Good. So there wasn't a lot of waiting time, which is good because that can happen. You can have about a half an hour wait time sometimes due to traffic. So
no waiting.
Good. Drink lots of fluids on your plane.
Tons,
okay.
Tons, yeah.
Sometimes it can be hard for people to drink due to flying and they don't want to, use the public washroom or whatever. But you're here at an early time, so we can get your 2 to 3 liters in today if we need to, and help you with that. The reason why we want you guys to drink a lot is because of the IV in the next morning when we do go to the hospital. it's easier for the doctors and better for you, right, to be hydrated.
Right.
So good. So you're gonna, try and get as much rest as you can tonight. No drinking past 12. I always tell my patients to drink as much as you can. You're going to be tired. You flew here today. So drink as much as you can until you go to bed.
Okay.
And then try and have your good sleep. In the morning, you can brush your teeth, but no water. Nothing to drink for about 12 hours per surgery. So.
Okay.
Yeah, so what we'll do is I'll meet you at 8 o'clock in the morning in the hotel lobby, and we'll go to the hospital and we'll get you ready to be checked into your room and go from there. So we don't know what time your surgery is going to be. They will let us know tomorrow morning.
Okay.
So.
All right.
So yeah, so once you're in your room, anxiousness and excited and nervous can all take place. But what I find is a lot of patients after their IV is done, they're more relaxed. They're just waiting for it to happen. So
Yeah.
it can be the hurry up and wait game, but you're on your way to your new life and you'll be great.
Yeah.
So
Good.
yeah,
Thank you.
you're welcome.
Hi, Carolyn. Nice to meet you. I'm Dr. POMPA. Welcome to LIMARP. Are you here for gastric sleeve surgery?
Yes, I am.
Okay. So basically, the first step when a patient comes in is to sign an informed consent document, okay? This is the folder you're gonna read. This is your acceptance document for weight loss surgery, and it consists of basically 4 documents.
Okay.
The first one is the acceptance document for obesity surgery or weight loss surgery. The second document, it's a general informed consent. The third one is for anesthesia. It's gonna explain what type of anesthesia we're gonna give you, okay? And obviously the anesthesiologist that is gonna help you with the anesthesia. The fourth document is for the Incentive Spirometer. This is respiratory exercises that you're going to do during your stay. Okay. And there's also a Bill of Rights, okay? Every patient that comes in to any hospital has their rights, and you have to be aware of them, okay? This is part of the informed consent, okay? So you can read it.
Okay.
Ready, Carolyn?
Ready.
Okay.
Good morning.
This is Irene, is our nurse.
Nice to meet you.
She will help us with the blood work and the EKG. Do you have any question about the informed consent?
No, I don't.
Okay. This bracelet is to identify you, okay? It's very important to use it.
Okay.
Let's go to the blood work. Follow the nurse, please. Have a seat, please. Welcome to your room, Carolyn.
Thank you.
Have a seat, please. So, Caroline, this is your room. Please have a seat here, and I will explain you some of the important things of your room. The most important thing is here, is your best friend, okay? After the surgery, if you need any help, just press the green button here, and the nurse or me, we will be here as soon as possible. The yellow up button is to turn on and turn off the lights. Yellow down button for the reading light, okay? Orange plugs are for medical devices, but you can use the white plugs over there and behind the bed. The buttons of your bed are functional. You can use it as you wish. You will find the gray remote control is for the TV. Very important, your gown. You have to wear them. You have to take off all of your clothes and wear it with the opening at the back. The compression stockings are also very important. You have to wear them from now until you are discharged, okay? And lastly, do you remember this? Okay, this is an spirometer. it measures your lung capacity and it will help us by the recovery after your surgery. Okay? Have you ever smoked?
No.
Okay. This is really easy, okay? You will find some holes that you do not have to cover. If you cover them, the balls will not leave, okay? Other than that, you can hold it with your left hand. You don't have to cover this. Hold it like this, and with the right hand, you are going to put it at your mouth.
Okay.
Once in your mouth, you have to suck in. Breathe in by your mouth, okay? So that the balls are gonna leave.
Okay.
Give it a try, please. Okay, another one. Okay, try to do it very quick, okay? And rest. Good one. That's perfect.
Okay.
Good morning.
Good morning.
I'm Dr. Vasquez. I'm the internist, and I'm going to be doing your preparatory evaluation. Nice to meet you.
Thank you.
The purpose of this evaluation is to establish if there are any risks for the surgery or any health issues that we have to be aware of, so we can give recommendations to the surgical team, okay? Your complete name is?
Carolyn Charlene Salinger,
Okay. How old are you?
47.
47. Very good. Okay. Some questions for you.
Okay.
Any history of high blood pressure?
Yes.
When was it diagnosed?
2003.
Okay. What about diabetes?
No.
Okay. Any allergies?
No.
Blood transfusions?
No.
Any other surgeries?
Umbilical hernia.
Uh-huh.
Bowel resection.
Okay.
Breast reduction
Okay, very good.
are the major ones that I can remember.
Any other intra-abdominal?
No.
No?
No.
Okay, very good. Do you smoke or do you drink?
No.
Very good. The colon surgery was because?
Diverticulitis.
Okay. And when was that?
2008.
Okay. Any complications with that?
No.
No, very good. Okay. Any history of heart problems?
No.
Murmurs, arrhythmias, heart attacks? Any
No.
history of strokes?
No.
Very good. Thyroid problems?
No.
Respiratory problems?
I get bronchitis quite often.
Very
Twice a
good.
year usually.
How often?
Twice a year.
Twice a
Oh,
year?
yeah.
With wheezing and...
Yeah.
Do you use a
Puffer?
a puffer?
Yeah.
regularly?
No.
Okay.
Just
when
it
you have
comes-
those
yeah,
episodes.
yeah.
Okay, very good. But no history of sleep apnea?
Yes, I have sleep apnea.
Okay. When was it diagnosed?
Oh, good gravy. Did I get my machine when I was with you, or probably 4 years ago, I would say?
So, okay. And you use a CPAP?
Yes.
Okay. Any other medical history? I saw on your chart there's some seizure.
Hyperlipidemia, yeah, and I have epilepsy.
Okay.
My last one was in 2008.
2008.
Yeah.
What
It's
kind of
blood pressure.
epilepsy? Is it generalized? Grand mal, exactly. Okay. And the last episode was 2008. Okay, very good. I have a list of your medications
Yeah.
already, so I'll write them down in your chart.
Okay.
Any history of depression?
Yes.
Okay. Right now you're under medication, right?
Yes.
Your state of mind right now?
Good.
Good? Good to go?
Fantastic, yeah.
Excellent, very good. Shortness of breath or chest pain if you walk more than 3 blocks?
No.
No? Very good. History of blood clots in your legs?
No, never.
Okay. Circulation problems?
No.
Nothing like that? Coagulation problems?
No.
Bleeding problems? Nothing
No.
like that?
No. No.
Very good. Let me check you up, okay?
Okay.
I'm gonna ask you to lie down. Any swelling in your legs?
No.
Not really?
No.
Okay. Let me check your eyes. Let me see your tongue. Okay, very good. Let me see your hand. Very good. Now can you please sit down to that side of the bed? Please. I'm gonna check your lungs. I'm gonna ask you to take a deep breath through your mouth and breathe out. Once again. Breathe out. Again. Breathe out. Again. One more. And the last one. Excellent. Very good. Okay. We're gonna be making some adjustments in your treatment while you are here because of the history you have of the epilepsy.
Yeah.
So we might use medication to substitute the one you are taking right now.
Okay.
Because you won't be able to take it maybe until tomorrow night.
Okay.
Okay?
Yep.
So we'll be looking out for the blood pressure too and your state of mind.
Yep.
Please let us know if there's anxiety or any neurological symptom that you recognize or anything.
Out of the sort.
So we can sort that out.
Okay.
Okay? Any questions for me?
Nope.
No?
Nope.
Okay. Well, nice meeting you.
Nice meeting
I'll
you.
see you later, okay?
Thank you.
Nice meeting you. Bye.
That was easy peasy.
Hi, Carolyn. How are you?
Good, thank you.
This is the big day, the day of your surgery.
It is.
So did they already explain that you're going to get an IV? You already have your compression stockings on. The internist already saw you.
Yes.
He told me everything was good with your pre-op. So the next step after they put the IV and give you the pre-meds for your surgery, we're gonna perform a gastric sleeve surgery.
Okay.
It takes about 30 minutes to actually perform the surgery. You're gonna be in the OR for about an hour because of anesthesia and the preparation for the surgery, okay? After surgery, you're gonna be in the recovery room for about an hour.
Okay.
And then they'll bring you here again to your room, okay? Do you have any questions before your surgery?
I don't think so.
No questions?
Not that I can think of.
Okay. After surgery, basically the two things we concentrate on doing for a good recovery, one is doing your respiratory exercises or your spirometer, which they already showed you how to do.
Right.
This is very important for you to breathe correctly. Actually, the number one complications after surgery are related to the lungs. So we're making a good effort of showing the patient how to breathe deeply and avoid those complications, okay? Also, you will be asked to walk lots, as much as you can, okay, during your stay. So basically that will be your two jobs for tomorrow morning, okay? I will see you in the OR.
Okay.
Okay, all right.
The International Center of Excellence program through the Surgical Review Corporation is a critical part of being able to ensure the safety and the standards for every single patient. To achieve an International Center of Excellence designation means that we exceed U.S. standards, and it means that every single one of our patients is going to have the safest surgery possible. And that's really what we want. We want everyone to be able to know that their loved ones, their family, their friends don't have to worry, that our patients are in the very best of hands. We really wanted to show what it's like. There's so much mythology and there's a lot of unknowns around having surgery, and I thought if we pulled back the curtain and we were able to show exactly what it's like from the very beginning all the way through the process, what it's like to actually have surgery and recover, and what it looks like in those first few months after surgery. I thought that would be a great way to be able to share our story and to share our experience and to put not just patients at ease, but to help them be able to put their family members and their loved ones at ease.
Hi, I'm Dr. POMPA. I'm the bariatric surgeon here at LIMARP, International Center of Excellence for Obesity. We just did Carolyn's gastric sleeve surgery and everything went great. I want you to see the part of her journey so you know what type of installations, facility medical staff we have here at LIMARP. Since we're a center of excellence, that means that we are in the 2% of U.S. hospitals that meet high standards for quality care in bariatric surgery. Something really important is the preparation of the patient. The time that they take to do the pre-op diet, to set up everything before their medical conditions, the evaluation by our internist before the patients come over here to Mexico and have surgery. The International Center of Excellence seal that we have here at LIMARP represents that we have the same level of care as hospitals such as Yale, the Mayo Clinic, and some other international hospitals that are based in the US. So I did my medical studies here in Tijuana, Mexico, but I also did a postgraduate course on laparoscopic surgery, advanced laparoscopic surgery at the Mayo Clinic, which is a US hospital, and also overseas in the Institute of Telesurgery in France. So this type of training just makes it all possible to do patients with the excess weight. We are specialized in patients with high BMIs also. We've done lots of cases. And what inspires me to work every day is to see the results and the change of life that patients have after surgery. Some of the patients tell me incredible stories about things that happen after surgery, like wearing their first dress, putting on their first heels, even getting divorced from someone that they weren't happy about being with, buying one plane ticket instead of two, for example. And basically I do it for the health of the patient. That is why I do bariatric surgery. When I first created LIMARP, LIMARP means the initials of my name, which is Lisa Maria Pompa, was in 2002, and I actually wasn't a surgeon when I created this unit. Other surgeons did surgery here at that time. When I did my specialty, I had the idea of transforming this hospital into a bariatric specialized hospital for patients with overweight and obesity. Everything you're gonna see in this hospital is created specially for that type of patient. The halls, the doors, the type of hospital beds that we have, gurneys, and also for the family to be really comfortable. All the, the couches and everything is made for patients that bring family members. Sometimes the family members of our patients are also overweight. So everything you're gonna see is based on having the best facility to take care of these patients. Hi Carolyn, how are you? Good morning.
I'm good, Dr. Pompa. Good morning.
This is your first day after your surgery. Do you have any pain?
A little bit.
A little bit. From 1 to 10, what is your pain level?
Probably about 2.
2.
Yeah.
Okay. All right. If it's higher than 6, be sure to tell us so we can give you some extra medication.
Okay.
Today basically consists of recovery. For a good recovery, we always say that our patients have 2 jobs here. One is walking as much as you can, okay? The other thing you need to do is be doing your respiratory exercises. How many balls can you lift?
About 2.5.
2.5, okay. So walking prevents the formation of clots, okay? Also, that is why you're wearing compression stockings, okay? And the number one complication after surgery, as I said yesterday, is always related to the lung not expanding well enough. So we will have you on those exercises every hour.
Okay.
Okay?
Yeah.
If everything continues to be okay today, Tomorrow morning we will do a leak test early to check your stomach, check that your staple line is sealed, and if that is okay, we will perform the discharge tomorrow morning. Okay? All right. Any questions, concerns?
Not that I can think of right now.
Okay.
The staff has answered a lot of questions. So
Okay.
they've been good.
Everyone has been treating you okay?
Fantastic.
Okay.
Yeah.
Okay.
Yeah, really
That's
good.
the way it should be. Okay. All right. Thank you. I will see you later today. Okay.
Okay. Yeah.
Thank you.
I'm feeling great. Actually, surgery went really, really well, and I'm not having a whole lot of pain, so it's very good. The night doctor was really good. I didn't see her a whole lot because I slept pretty good last night, but when I did see her, the night doctor was fantastic. Like, I would refer any of my friends here that wanted to go through with bariatric surgery. It went really well. Staff has been fantastic. Dr. POMPA is fantastic. Yeah, it went really good. The surgery isn't as bad as you may think it is. It actually goes very smoothly and very minimal pain after, but mind you, healing is different for every person. But ultimately, in the long run, I think it's the best decision for me.
So we are here on your last day, your day of your discharge. Okay. How was your leak test this morning?
It was good.
The liquid of the leak test, was it a good tequila, or what do you think?
Yuck.
It tastes very bad. Okay. But this is the contrast we have to use to see that there's no leak in your study. Okay. So your study was clear. There's no leak. They already pull out your drain. Okay. And so I'm gonna explain the indications for your discharge. Okay. We will provide you with this folder. In this folder, you will have the medical report of your gastric sleeve surgery. Okay. On the last page of this report, we will have the image of your new stomach. Okay. This is the image of the study we did this morning, the leak test. Okay. So this is the paper you want to keep for your doctors to see. Okay. Okay. You will also have a post-surgery steps sheet which has the time and date of your hotel pickup by our driver. Okay. Be sure to be at the lobby at that time so you don't miss your plane. Okay, so you can catch it on time. You will also have a book that I wrote for my patients. These books will have some extra tips there for you. Okay. You will also have a white prescription which has the indications of the meds you're gonna take for your surgery. Okay. These medications are the ones we're gonna provide you. And also, because you take some of your own medication, you will have a yellow prescription with the indications of our internist on how to restart your own medications. Okay. The white prescription basically says how you're gonna take the medications for your surgery. Actually, we have them lined up here. So the first medication is gonna be the Almax. The Almax is a liquid medication. This is to basically protect your stomach from acid. You're gonna take, it's a liquid medication, so you're gonna take 1 tablespoon 3 times a day or every 8 hours. The next medication is Omeprazole, which is a proton pump inhibitor. This also blocks acid. Okay, this is a capsule, and you're gonna take 1 every 12 hours. The next medication, this is for pain. It's every 8 hours. It's an oral Ketorolac, which is an analgesic. And also we're gonna have a sublingual presentation. Okay. The sublingual presentation, you're not gonna take it with a constant hourly basis, but you're gonna take it in case of a lot of pain in case of is necessary, okay? And the last medication is the Cipro. The Cipro is an antibiotic. Generally, all the antibiotics are big pills, okay? So the Cipro is gonna be 1 every 12 hours, but because it's a big pill, you're gonna cut it in half. You're gonna take half, wait half an hour, and then take the other half in the morning. You're gonna do the same at night, okay, with the Cipro. We also have some gauze, tape, and Neosporin cream. You've been washing your wounds with soap and water during your stay. You can wash them with Dove white soap or neutral soap, okay? Don't use anything that has like alcohol in it or a lot of perfume. You can wash your wounds, take everything off, wash your wounds in the shower, pat them dry, apply some Neosporin cream on them, and then cover them with gauze and tape for 7 days, okay? After 7 days, you're gonna get a stitch out where they took out your drain. You're gonna have a black stitch. That is the only non-absorbable stitch that we leave, okay? So you can take that out with your doctors. The rest of the wounds are sutured with absorbable material, so it's not gonna even show. It's gonna dissolve. What else? Do you have any questions until now? No. It's very important that you also wear your compression stockings 7 days. You can wear the ones that we provided you with, or you can change to knee highs, okay? Yeah. And also, we're gonna continue doing your respiratory exercises with the Spirometer during 15 days to prevent any lung complications, okay? I'm gonna grab the water bottle we have here, and we're gonna, I'm gonna show you a golden rule that we have. This is very important. This bottle is an 8-ounce bottle of water, actually made a special label so my patients don't forget that they have to drink 4 ounces in a period of 30 minutes. This is yours. So what's very, very important is that you know that your stomach empties in about 30 minutes. So when we start drinking, we cannot surpass 4 ounces in that period of time, which would put, if you put more than 4 ounces in a period of 30 minutes, it would put the staple line under stress if you put more than what you're supposed to. So be sure to time your liquids. My recommendation the first weeks is just to sip with a spoon or from the cap of the bottle. And be sure to say, oh, I'm starting right now at 10 a.m. to 10:30, this is my half a bottle that I'm gonna drink, okay? So you know, and you quantify your liquids, and also you have a good knowledge of how much you're intaking a day, okay? Is this clear?
Yes.
So it doesn't mean that you drink 4 ounces in 5 minutes and then you wait 25. No, you have to be drinking little by little until you complete the 4 ounces in that period of time, 30 minutes, okay? What else? Do you have any concerns that I can address? Vitamins, this is another topic. We recommend you to start your vitamins at week number 5. Not right now, because we have a lot of medications that you're going to be taking. So that your vitamins, we're going to start them at week number 5. Okay? All right, so also we're going to see you tomorrow morning for an appointment here to check your wounds, check your vitals. We will see you again in the morning. I hope you have a good day at the hotel. Don't overdo it. Just walk and breathe the same as you did here, okay? And there's some broth also at our hotel services, and they have, you know, the sugar-free popsicles and everything that I recommend for the first weeks, okay? Okay. All right, see you tomorrow.
Thank you.
Thank you.
Before we had come here. My husband had reservations because of safety and what the area may be like for him for doing a little bit of tourism while he was waiting for me. Come to find out that it's very safe here, both for him and for I. The clinic is run to a T here, and everything is run fantastically. And even for those companions that come along with you, they can walk the streets and they have no issues that come up. So it's very safe, and we're glad that we took the opportunity to come and find out that everything was okay here and it worked for us, and we were able to go ahead with the surgery and everything went well. I think that what people need to know is this is not a magic solution. Even from yesterday to today, we have work to do. You still have to work at your weight loss and proper eating habits and exercise and all that. So it's not going to be an easy road, but we can do it with help from others who have had bariatric surgery, from our facilitators. There is a lot of support out there. It feels great to go to the hotel. I can't wait. I'm having a little bit of pain, but nothing overly that much. So I'm looking forward to a couple days in the hotel and then on my way home. A lot of people think that getting bariatric surgery is a quick way out. It's not. It's a lot of work. You've got to make sure you get your protein in, that you're eating properly, that you're exercising. And I know a lot of people are probably thinking that of me, like, oh, you just want the easy way out. It's not easy, but it's so worth it. So worth it. I'm doing this for me, and you can't do it unless you're doing it for you, because I've tried it before, doing it for, you know, my kids or my husband, or yeah. You have success when you do it for yourself. Wow, I've done it. I've done it. The biggest difference is no more shortness of breath. I don't have pain anymore when I walk. I used to walk a block and I'd have pain in my hips. It was horrendous because it would be so hard to get back. So I don't have that pain anymore. I used to always need to nap. I don't need to nap anymore. Some days it's nice, but you know, it was hard to get through the day when I was heavier. Just how when I'm in my husband's arms, how I can just notice the big difference in, like, I never used to feel anything up here because this was always out here, right? So that's probably my biggest difference that I notice since losing the weight. And he does too. He'll hug me and he'll say, "Where'd my wife go? You know, where is she?" I told him I, you know, when we hug and stuff, like, I can actually get around him now. And I said, we can get so much closer, which is another amazing thing because I feel the difference. It was probably my best hospital stay ever. Partially, I'll say, because there were only so few patients in there within 1 week, so you get good care. And then once I left the hospital, I still had my support system with Connie. So it was just fantastic. That's all I can say. And if somebody is looking into this and wants the surgery, they don't have to worry about anything. It went fantastic. Really good. And my husband was quite happy about it too, with the safety of the location, and yeah. Oh, Dr. POMPA, thank you for giving me my life back. Thank you so much. I've struggled with my weight all my life, and to be given this opportunity has been so amazing. So amazing. Because I found as I got older, it was harder, so much harder. And Dr. POMPA, you're a fantastic doctor. And I'm glad that you got to see my success. So thank you. Anyone that's considering taking this path, it is so worth it. I have had friends ask me about it. I know some may have financial concerns about it. It was worth every penny that I paid, and then some. I think the biggest thing is trust your success coach. She's there to help you through everything, to get you to Mexico, it transitions so easy to get to where we needed to be. And that was so important to me, because whenever I travel anywhere, I'm always like, oh, okay, where's this, where's that, you know? So you have support there to take you through every process. And I guess what else I want to say is Dr. POMPA's fantastic, super doctor. I'm a nurse, and I fully trusted her in everything that we went into with the surgery, the follow-up, and everything went really well. And I know a lot of people have concerns because of location, sterility, certification of the whole hospital and Dr. POMPA, and I tell you, Dr. POMPA has everything to the T. And I would do this again if I needed to. But I won't need to.